Quantum healing, the future of medicine.
What are the negative emotions? There's many, but anger is one, fear is another, paranoia is another, anxiety is another. These are heavy emotions. These are not light, happy emotions. And they settle into, which we know now through researches, that it even settles into the DNA system of the body. So it is in every single cell in the body. It settles into human tissue. And unless we're clearing these out, which we don't teach people to do, and we don't allow metaphysicians to operate in the mainstream medicine arena, because insurance companies will not cover those kind of healings, you've got a lot of ignorant people. They don't know what to do with it, and they're not shown how to release it. And the very people they would rely on, like physicians and the mental therapists, also don't know. I was amazed one time when I was talking to someone that wanted to know the kind of work this was, who was very proudly telling me that she was a psychotherapist. She had studied to become a psychotherapist, but she was first in the military. So she herself had, of her own admission, had very bad PTSD. So she went to study psychotherapy and try to help others not have PTSD. And you can see how crazy that would be. How such a lapse of understanding that could not possibly ever work. If you yourself do not know how to release any of these negative emotions, and no one has taught you the method, how on earth could you go to someone else with the same disorder and help them in any which way, other than sending them to the psychiatrist for the drugs, which definitely do not help, because you've already got an imbalanced mind, so you do not need it more imbalanced by taking any of these heavy-duty drugs. So it's a very strange system that was set up, and she herself, by her own admission in this conversation, said that every time she treats someone, she gets all triggered and she needs a psychotherapist to help her now because she's triggered. This is ludicrous. This is a ludicrous system that we've created to help this particular group of people. It was one of the great impetus I had to get some of this information out, because it's so frustrating to watch, and in my opinion quite idiotic to be trying to treat it that way. It shows a complete lack of understanding of what the quantum is, or what the creative energy is, and how, as a result of that quantum energy, that we even have a physical body. You can't possibly be studying anything to do with the physical body, which is the last rung of all the 5 bodies. In order to operate in a third dimensional world, you have to have a physical body. If we did not have the physical body, we'd be in the higher realms and you wouldn't see us. So in order to operate in 3D, we have the physical body. But suddenly to think that is it, that as long as you treat this physical body, this is going to be successful, and completely ignoring how did this physical body even come about, that in every single cell, in every atom of our body, of which there are trillions, could we possibly heal or bring somebody to health without the understanding and the paradigm that there are 3 legs to this healing, which is physical, mental, and spiritual. Spiritual being the metaphysical. So people tend to think in this realm that spiritual means church or praying. That is an aspect of it, but you can learn to heal with it. In fact, all the great prophets or the great spiritual masters could all heal. The higher one's spiritual knowledge becomes, the greater your healing skills, because you are tuning into the quantum. And the quantum is electromagnetic energy that one can use to heal anything in the human body, because the quantum knows everything about you and your body. It knows history. It knows what happened to you to get to this point. It knows the pattern that was created the sort of the traumatic pattern that is now embedded in your body that needs to be reversed. Can it be reversed? Absolutely. And that's where I found myself, is to the point where as I internalized on this disorder, I felt the heaviness. I knew where it was. I could not find anybody that had the knowledge that I needed to get it out, basically. And I worked on a principle of opposites. That's universal law. What goes up must come down. What goes in must come out. It is universal law. There are no exceptions to that. It doesn't just go in and stay there. There has to be a method that it comes out. And that's what I started to base my research on. I had established that it was in, and that it was creating enormous amounts of problems for me personally in my life. And I did not want to see the rest of my life go experiencing that condition. I just did not. It was unacceptable to me. I just did not want the emotional handicap of it. You know, one felt disabled, basically, and you are, because you're constantly, every day, kowtowing to this crazy, triggering and emotional seesaws up and down. It's absolutely awful. And when people are that desperate, they will turn to all kinds of anything to relieve it. It could be alcohol, it could be drugs. The stories are endless and nightmarish on how people try to cope with this condition, and in its worst stages, people will take themselves out and commit suicide. And I have helped quite a few of those that were in the process of trying to commit suicide when, you know, Creator intercepted in whatever way, and they ended up in front of me in one form or another through people, friends. And if you can take that person and turn them around in 3 months of treatment, which is 3 months, once a week, 1.5 hours a week, and completely turn the worst cases of PTSD over in 3 months, you can see how dramatic this is. And it would only take that long, because one has to be so careful with someone that is trapped in the cycle, the trauma cycle. It has to be done very slowly, gently, very, very ethically. And that is the time when you use intuition, is how well this person is releasing. Some people release very fast. Some people release much slower. So one has to be very, very aware of what's happening with that person, and where sessions end, that people don't push themselves too far, because we don't want purging at the end of the day. Purging is not what we want. We want to keep someone as stable as possible, as balanced as possible as we're releasing, and as they're starting to go through the experience of releasing these heavy anchors, which just dissolve when you touch them. If this technique is done correctly, the person, the client, it just becomes lighter and lighter, and as a result, happier and happier, and the body self-corrects very quickly. We are self-healing organisms that need some help in this case, because people don't know how to release those heavy blockages. And we're not talking about the physical body here. We're talking about the metaphysical bodies. Develop these very heavy blockages that need to be gone so energy can run through clearly. So if you picture a whole arterial system that is usually in its, healthiest, is just zooming with energy from the cosmos, running through the body, feeding every cell in your body with this high octane energy, basically. And that energy, again, is plugged into the neurological system, and you have that electricity as well. But that's not the electricity we're talking about, but it gets affected by it. Absolutely. So there is a cycle of trauma, which is very interesting. And people that have gone through serious traumas, as I go through the different stages, how you develop PTSD, will recognize a lot of these. Yep, that happened. And how do we get to the place where we are now someone that's completely trapped in our bodies, triggering and experiencing all kinds of negative emotions that you can't control? I think that was the worst for me, is that when I was getting triggered by whatever, I couldn't control it. It sort of just took me over. And the only way I could cope and cope out in the world was to sort of, disappear for a while, just go underground until this thing kind of calmed down and worked itself out. And often in my case, I can say sometimes that would take 2-3 days. So I lost 2-3 days of my life every time because I didn't know, and no one seemed to be able to help, how to control these out of control emotions one would have from triggering from the trauma cycle. So there's always a primary scenario. And in fact, oftentimes as we're going through life, we'll repeat these scenarios because it was unresolved the first time that we experienced it. For the sake of just talking about the cycle, we'll call it the primary scenario. It's whatever a client senses is their trauma history. And we do an intake, a very extensive intake before we even start with anybody in treatment, to kind of tune into them a little bit and find out what, in a very light way, this is not about talking about the trauma. That's where we absolutely diverse from mental therapies. Psychotherapy is that they want to talk about it. They want you to express emotions and feelings, and this does not go well. I can tell you from being on that other end of it, that's the last thing you want to be doing as someone who's trapped into this disorder, is talking about it. I one time had a therapist that actually encouraged me to walk to the actual, in my mind, go back to the actual trauma experience, and it was absolutely horrendous. Absolutely horrendous experience. And I ended up in the parking lot, I do remember that, unable to even drive. I could not even start the car and drive. I was afraid what would happen on the road. I just sat there absolutely frozen in negative emotions. And after half an hour of really trying to calm myself down, I managed to get to a friend of mine that was a chiropractor, which was like half an hour away. And he was horrified as I walked in, and he immediately said, "What on earth happened to you?" And I explained it, and he just couldn't believe it. And it took him maybe half an hour to settle my body down from that experience. So, whoever the psychotherapists are out there, that is just not the way to go. If you want to practice psychotherapy, then at least learn about the quantum energy and how that functions and how that relates to the work that you're trying to do. That would be very helpful so that you know what to do and what not to do in your training, because there absolutely is a place for psychotherapy. It's not discarded. It is part of the 3 legs of the paradigm. But you have to understand what the quantum is all about and what metaphysics is all about in order for you to be an effective physician, and in order for one to be an effective psychotherapist and an effective, definitely, psychiatrist. I mean, if you're not considering this, there's just such a huge chunk of a lack of knowledge that you can pretty much count you're going to screw it up when it comes to post-traumatic stress disorder. And anyone I know that's got PTSD absolutely knows that taking drugs is just the worst thing possible. And the other alternative that we've got in order to help people with that, besides them self-medicating or going to liquor or street drugs, which are horrendous as well, is now turning to, the marijuana. That is huge because it has such medicinal properties to it that can take down inflammations, be very helpful with pain, and very helpful for so many things that people are experiencing in post-traumatic stress disorder. However, having said that, at the end of the day, it's still in there. So I had gone through all these things earlier in my life and doing a lot of thinking about them and observing and having treatments done to myself, what was working, what wasn't working, why it wasn't working. And it all boiled down at the end of the day, it's still in there. And as long as it's in there, you're going to have the repercussions of it, and you're going to be suffering from this lack of energy, of quantum energy running through your body, which you need to recover from illnesses and diseases. You need it. It's the most powerful energy that exists. Because we plugged into the neurological system, that electrical system in the body, that too gets affected. Because if the quantum is blocked, it's not feeding properly the neurological energy. Stands to reason. You've got to go to the root. The root cause is blockages in the meridians, which the meridians are the quantum energy, God energy. As long as there's blockages in it, however it plugs into the physical body, there's blockages in that as well. So at the end of the day, the question is, how are you going to get it out? Now, logically, according to our sort of ignorant level here, you talk it out. And I can assure you, you do not talk out trauma. It's gone way, way beyond just talking about the experience and it's all going to go away. Is it helpful? Absolutely. I do not like to work with anyone when I'm working with the quantum because it's such a potent energy. I do not need someone still mentally embroiled in what happened to them in a trauma. So in my opinion, before you go to any metaphysician, you definitely need to go to a well-trained trauma psychotherapist or trauma therapist and have them work with you for about 3 to 6 months. So you get some kind of balance of mind, that you're not so hot and so unbalanced in the mind that when you're dealing with quantum energy, which is 1,000,000 times more powerful than anything our bodies can produce, is that you're not exacerbating the triggering, and that it's done properly, that it's done very ethically, it's done as slowly as that person or as fast as that person can handle. And again, that's something individual. You're watching for all these things, how to help them release without damaging themselves, unbalancing themselves, or going into any kind of purging. That's what you don't want. You want to keep them nice and balanced all the way through. I have had it sometimes where someone is releasing quite fast and wasn't ready to come back the next week. And that's fine too. We'll give them 2 weeks. Sometimes it's 3 weeks. So there's no hard and fast rule on how long or how slowly someone needs to release. It's very individual on how these people do that action with your help, but they're doing it. They're releasing and empowering themselves doing it. So we have the primary scenario, and the first thing that happens when you have a trauma is definitely disempowerment. I remember that moment very well when we tend to, our whole life experiences are in a little box, sort of that's known of what we know about ourselves, especially as a child. We haven't expanded our box very much, and we have our knowns and everything outside is unknown. And this just blows up. I mean, trauma comes out of left field. Trauma is something you very rarely see coming at you. And one moment you live in this life and the next minute you don't know who you are. Everything you've known to that point, everything that you experienced up to that point, this is way beyond and outside of the box. So you get lost. You don't know who you are at that moment. You lose the sense of self. You lose that wild, instinctual nature that you had before. You become safe. You don't feel very empowered because you have this sense of, I don't even know who I really am anymore. It's something you have to heal from, and it's often takes a very long time, if ever, if they're not treated, for people to gain that back. So you have a lot of very insecure people from these experiences because they never really got confidence in themselves or developed it again, because that was sort of taken away in the trauma. That's something that just happens. It's a fact. A loss of choice. Suddenly you just, because you don't know who you are and you've lost your box, and these shattered pieces are all over. You got to kind of gather this all together, bring it back, and reestablish who you are. And it's a huge, big task, especially for a child, to try to internalize all these heavy emotions that they don't understand but they're feeling. The abuse of children is probably the most horrendous thing that you could do to anybody. They have absolutely no defenses in any which way to be able to cope with abuse of any kind.